Hi guys, Dr. Aman here. I'm going to be talking about the hip joint today as what to do when it is developing arthritis. So hip joint is supplied by, there's three major muscle groups involved in the grinding and crunching of the hip joint. So these movements. So when the hip is tight, when these muscles are tight, they're going to be grinding the hip joint. And the classic thing is you can't run because the muscles are so tight. So iliopsoas, which is at the front of the hip, that travels commonly with quadriceps tightness at the same time. So look up iliopsoas and quadriceps tightness online. One exercise lasting about a minute in 20-second increments. So you do it, stretch it for 20 seconds at your limit without much pain. Then stretch it again for 20 seconds. Don't go into much pain at all, just minimum pain is fine. And then again stretch. This way you can progressively stretch more. So this is for the front compartment. For the medial compartment, it is you stretch the adductors of the hip joint. Those hip adductor stretches are useful. And the third is the abductors, abductors, abductor stretches of the hip joints. Pigeon stretch is pretty good. Iliopsoas quadriceps stretches are pretty good. Take collagen peptide 5 to 10 grams with that every day, whatever you tolerate. Powder is cheaper than tablets and capsules, so it gives you a better bang for your buck. So these three kind of stretches will make a lot of difference for your hip, how it feels. And collagen peptides, within 3 months, God willing, you should see significant improvement in the hip joint, so it's not going to be grinding and crunching as much, and majority of people will see a lot of benefit from them. Take care, and I will talk more about the hip joint later.